Families deserve to be together, but families experiencing homelessness, young families, are more likely to have their children taken away. According to research, young families, young people who are experiencing homelessness are more likely to have threats to their health, safety, and well-being. They're more likely to miss school. They're more likely to resort to crime as a way of survival. The problem is it's bigger than we actually think it is. 1 in 10 young adults and 1 in 30 children will face homelessness this year in the United States of America. That's where family independence comes in. We keep families together. Family independence provides a stable, calm, and warm environment for families experiencing homelessness in Dorchester, Mattapan, Roxbury, and the South End. We work hard to keep families together. Families come to us because they have nowhere else to go. Whether they're 16, 24, or 40, they have one thing in common. They're at risk of losing their children because they're homeless. Families have different needs, and so we meet them where they're at. We provide intervention and screening referrals for the children, workforce development for the parents so they can get better jobs, education support, mental health support, and childcare, which makes all the difference. The goal is that families are self-sufficient, they have their own housing, they're productive members of their community, and they stay together. We have 2 programs. Our Young Parent program serves teens between the ages of 12 and 21. The focus of that program is that we make sure that they're enrolled in school, they develop life skills, and that they're able to have childcare for their children. A teen that comes into our program can stay between 3 to 5 years depending on how old they are when they enter. Then there's the shelter. The shelter serves women over the age of 22. The focus of that program is to help them do housing search, workforce development, case management, and advocacy. We follow each family for 2 years after they leave our program. Each family actually lives in an apartment that they share, and they're responsible for keeping it clean and organized. And they have 24-hour support from the staff of Family Independence. So now I'll tell you about Deirdre. Deirdre came to our program at the age of 19 with her child, angry, frustrated, and not wanting to be in a program. She showed her discontent by cursing staff out, not following curfew, just not following program rules. So we jumped into action. We met with Deirdre several times and came up with a plan to meet with her school with her permission. We track her attendance, make sure she got her work done. After living with us for 1.5 years, she was able to graduate from high school and move into her own housing. And now I'll share about Susie from our adult program. Susie came to our program with her 12-year-old son, Don, and 2 children under 2. When she came in, she expressed that she felt really sad and depressed because she was not able to accomplish her goals. She had been previously evicted from an apartment. We then figured out that Don was acting as her childcare provider. So we met with her and came up with a plan for Don to go to school. We found him an after-school program and a summer program in the community. And we also helped Susie to get childcare so she could accomplish her own goals. I'm happy to report that Susie moved into her own apartment this past month, and she shared with us that she now feels better equipped to take care of herself and her family. Now, we know our program is impactful and it works, and the demand for our program is growing. In Massachusetts, we've seen the rise of homeless youth go up to 38% in the past 3 years. That's why we need to raise $420,000 to hire 3 clinicians, connect with the community, so we can actually meet the demands and impact. We also would like to definitely connect with services in the community so that we are partnering, improving our partnering. So we ask you to join us and invest in the families of Boston as we continue to help them break the cycle of homelessness and improve the lives of the children.